Good evening, Los Angeles, and thank you for joining us this evening for the latest update on COVID-19 here in Los Angeles. And thank you, as always, for everything that you are doing in the most trying of times to save lives and to rebuild livelihoods. It's a pleasure to be here in the San Fernando Valley, where I was born and grew up, and to be here in Reseda at the Jewish Home for the Aging, which has been one of the pillars of our community for so many years. Breathing hope and help back into the lives of countless Angelenos. I'm joined here by some superstars, and I want to single one out who couldn't be here this afternoon, but who has been an amazing partner, Councilmember Bob Blumenfield, who together with his staff in Council District 3 have given so much support over the years to this place and have been such a key partner in the work that we're doing to save lives and to save livelihoods. Thank you, Councilmember Blumenfield, to you and your team. But as you can see, we have Chief Ralph Terrazas that's here with us, Assistant Chief Katie Kepner, and who is the lead on our mobile testing program, as well as Dr. Noah Marco, a friend who's also the medical director here at the Jewish Home for the Aging. And before I talk about COVID-19, I just want to say something about our firefighters. This was a very emotional and tough weekend. On Saturday night, many of you saw, after the fire that we saw downtown, 12 of our brave firefighters had to go to County USC. Some of them with what were critical injuries. And thank God I was praying the entire way from my house to the hospital, hoping it would not result in any of their deaths. Thanks to the great medical professionals, the courage of our firefighters, all of them are alive still today, and we expect all of them to live. The toughest injuries, there was surgery on today for one of our firefighters, and that went well. And we now still have 4 that are hospitalized, 3 at County USC and 1 out here in the Valley. But we are doing everything to pray for their quick recovery. The brave men and women of Los Angeles Fire Department put their lives on the line when we see fires like that. There was another large fire at 4 a.m. this morning at a fabric warehouse near downtown, and 112 firefighters responded, and fortunately there were no injuries. But you've also seen our firefighters on the line at our testing centers, something I wanted to talk a little bit about today, and testing in general, as well as the ways that we can save lives. Tonight we're going to talk about what we're doing to save lives, some new announcements of some openings, and also talk always about the data that drives this. But we also have to protect those heroes that protect us. Doctors and medical professionals, firefighters and others, and that begins with the decisions we make. The decisions as individuals and businesses, as community members to reduce the spread of coronavirus and to save lives. Decisions that make sure that our first responders can roll out to fewer calls. Our doctors and nurses see fewer COVID-19 patients. Decisions that allow us to get back more of those things that we cherish so deeply. Now, as we begin to reopen more businesses and open more activities and spaces for us to be in, we must continue to do 4 things to stay safe, healthy, and secure, and continue reopening in our city. First, stay safer at home. Second, keep practicing physical distancing. Third, wash your hands and sanitize surfaces. And fourth, wear a face covering. It's that simple. These things unlock the possibility of more and more and more steps in the days to come. The more of you that stay safer at home now, the less of us will have to stay safer later. The more that you keep your physical distancing, the quicker we'll be able to return to even more spaces. The more you wash your hands as you enter your home, the faster we'll stop the spread. And studies indicate that we could dramatically limit the spread of respiratory droplets by just covering our faces. So to everyone who's begun wearing a face covering in your daily life, I just want to say thank you. I know it's a change. For some, it feels like an inconvenience, but they will make an enormous difference. These 4 actions, including face coverings, are part of a system to stop the spread of this virus, to give us back our city and our lives, to see a day in which people aren't dying, and a day in which we are thriving throughout Los Angeles. And that's why tonight I can announce a few new businesses that we are reopening in the city of Los Angeles. Effective immediately, all pet grooming and training retail businesses and mobile services are allowed to operate. Customers will be able to drop off and pick out their pets outside the store, but like other retail that has opened, only employees can enter these shops. So you must give your pet to the groomer outside the store. Retail locations must adopt the county's retail protocols, and mobile services must adopt the county's physical distancing requirements. and any mobile service provider should not enter a customer's home. And additionally, we are now opening all car washes, and they must adopt also the county's retail establishment protocol. We had previously allowed only automated and self-service washes. All of these protocols are easily obtainable if you go to coronavirus.lacity.org/business. These are really important steps forward, and data is a critical tool to guiding each one of those decisions. So let's check out today's data. Today, the county reported 1,183 new cases, bringing the total to just under 40,000 cases diagnosed here in Los Angeles, 39,573. This was a 3% increase since yesterday, and on average, over the last 7 days, we have seen about 940 new cases diagnosed each day. In the city, there are 480 new cases, bringing our total to 19,020 cases, also a 3% increase. And today we learned of 76 new deaths countywide, bringing the total to 1,913 fallen Angelenos. This is a 4% increase since yesterday. Yesterday we had a very low number and today a very high number. If you average those out, we're still staying steady. But this was today, at least in a 24-hour period, the second highest number of deaths that we have seen. So anybody who thinks that we're out of the woods, we are not. This remains as dangerous today as it was on day one. What has changed is we are getting smarter about how to combat it. And that's why we're asking you to wear a face covering when you're outside. Figure out how to get to yes. Help us say yes to more and take more steps forward by being responsible with our actions each day. Good news still in our hospitals. Our county general emergency hospitals have 1,133 beds available, 938 of them in acute care, and 195 of them for ICU beds. And we have an inventory of 1,321 available ventilators. That is good news. That meets many of the metrics that either the state or nationally accepted standards allow us to say we can check that box off for now. But we want to protect the highest risk individuals so they don't have to go into hospitals. And I'll talk a moment about our mobile testing program in senior centers like this one. We're also meeting the challenge of this disease through Project Roomkey, which is our partnership with the state of California and the county of Los Angeles to get Angelenos who are experiencing homelessness off the streets and someplace safe in our hotel rooms and motel rooms across LA County. Tonight, I'm proud to announce that we have secured a second hotel in downtown Los Angeles where we know for 4 decades we've had the highest concentration of people experiencing homelessness. This will deliver 150 more rooms, as well as a hotel in Mid-City that will provide nearly 100 rooms. So that's 250 new rooms just today. Together, these additions have increased our overall number to more than 3,500 rooms countywide in the last 6 weeks, and the Los Angeles Homeless Services Authority has filled these hotel and motel rooms quickly, mostly within 2 to 3 days. I know there's an article today about how half of them were unfilled throughout the state, but I'm very proud here in LA County, we're at very high occupancy and we're moving fast. When we talk about stopping the spread and saving lives, the challenge that is greatest is in skilled nursing facilities, like this one right here. We see that borne out in the data, and I really wanted to talk to all of you about this tonight, because as we get smarter in combating this disease, we can disproportionately save lives by focusing our efforts in places like this, where we have unfortunately seen, not specifically here, but in senior nursing facilities, a disproportionate number of those that we have lost. 52% of all of our deaths in LA County have been in institutional settings, with most of those being in skilled nursing facilities. Early on in this crisis, it became clear that many nursing facilities did not have the resources or the connections to be able to get the tests to detect the virus and to prevent the spread. We had infection rates in some as high as 80 to 90% among residents in some facilities. The city acted quickly to address this threat. On April 2nd, we deployed the first LAFD rapid response team to bring testing straight to nursing facilities. And I want to thank Senator Henry Stern, who contacted me on March 28th and said, this facility needs help. And this happened to be the first place we rolled out to. To get the job done after that first team, we added 2 more mobile teams and charged them with testing every resident and staff member at each skilled nursing facility in the city. It was a mammoth task at the time, but an important one. And as of today, I'm also very proud to say that with 3 mobile testing teams, we've completed testing at 101 of the 135 skilled nursing facilities in the city of Los Angeles, with more than 25,000 residents and workers in these facilities tested. We're getting this done through the power of partnerships. Early on, we contacted those folks who run these facilities, but we needed to supply a steady set of tests to them, ones that they could use in these facilities. So thanks to UPS and Everlywell, the lab that had the tests and the company that could transport them for free, we were able to start rolling these teams out and rolling these tests out. And with the County Department of Public Health providing us with tactical information about where positive cases were coming from, as soon as we'd heard, we'd surge over to those places. And with Dr. Noah Marco here at the Jewish Home working with the city, we began to identify facilities in need of testing. Now, some facilities have been reluctant to conduct testing or told us they're doing testing through private resources. So I required, through an emergency order, the first big city in America to do this, that all skilled nursing facilities in the city of Los Angeles had to conduct testing for all residents and workers at least once per month. And the order also required that facilities have to deliver notices of that testing date to all residents, to all workers, and any member of the public, press, or government who asks for it. This up-to-date notice must also be publicly displayed at the main entrance of each facility to ensure accountability. And I want to thank Dr. Noah as well for his advice on this. Skilled nursing facilities may request testing kits from our city's LAFD Rapid Response Mobile Team if they cannot provide them on their own. We would like to see folks be able to do them on their own, that's the goal. But if you can't, we are here for you. So please go to coronavirus.lacity.org/testing and scroll down if you are a skilled nursing facility, and we will roll our teams out to you. As a reminder to all of Angelenos, anybody can get tested. There are more than 30 testing locations across the county. It doesn't matter what city you live in or what part of the county. It doesn't matter whether you have symptoms or not. Today we have the capacity to test 21,000 people a day. The threshold metric for opening more up is 15,000 a day for LA County. So we are able to do that each and every day, another check mark for opening more up. By the end of today, we will have tested nearly 400,000 people. It's a staggering number, and I have to thank my brothers and sisters in the fire department, all the volunteers and CORE and everybody else who has helped. We were trying to get a couple hundred tests at the beginning of this in a week. Now we're nearly at 400,000 tests, nearly equivalent of 10% of the population of LA City, but that's countywide. So to get tested, go to coronavirus.lacity.org/testing or call us. If you don't have an internet connection, call us at 213-978-1028, or after 5 p.m. you can just call 311. Being here at the Jewish Home for the Aging isn't solely about highlighting these bold actions to protect Angelenos. And nothing makes me sadder when I hear people say, oh, mostly who is dying are people who are already sick and old. These are lives, and these are our family members. These are critical people who have so much to still give to their families, to this city, and to our world. Nobody is disposable or dispensable. And it's a reminder here that everything we do is rooted in our commitment and our values as Angelenos, that we care for our seniors and our most vulnerable, that we look when immigrants are left behind by federal legislation, that we look at a disproportionate death rate in the African American community, that we see our seniors and people who are sick already and we protect them, that we look at those people experiencing homelessness and we give them masks and tests on the street and offer them beds to come off of the streets. This is who we are, Los Angeles. This is what we are about. And this will be the chapter we write together. And that's what you have the power to do every day when you stay home, when you wear your mask, when you wash your hands, when you physically distance. You can save lives, so keep staying healthy, keep staying safe, and whenever you can, keep staying home. As always, I want to wish you strength and love, and I'm going to turn it over now to LAFD Chief Ralph Terrazas, who will say some words and introduce Assistant Chief Kepner and Dr. Marco. Chief?
Thank you, Mayor. First thing I want to say is thank you to the outpouring of support to all the people from around the world, from throughout the country and the region, regarding the safety and well-being of our firefighters that we injured last Saturday. Now to the topic at hand, we've been partnering with Mayor Garcetti since the start of this COVID pandemic. We focused in 4 primary areas. The first area has to do with our ability to set up test sites for drive-through testing. We now have 8 sites throughout the city. Initially, it was staffed completely by firefighters, but with the arrival of the CORE organization, led by actor Sean Penn, we've been able to transition to a volunteer model. And I must say that the volunteers from CORE are doing an outstanding job. The second area has to do with providing testing and training at retirement homes and skilled nursing facilities. As you heard the mayor say, we're almost completely done with going through the inventory that are located within the city. The third area has to do with people experiencing homelessness. When we were tasked with a mission to provide testing to that population, we set up a model and located it within Skid Row. It has become very successful. We've been able to streamline that, and we're now able to take that on the road to go to other areas of the city where we can test people experiencing homelessness. The last area has to do with testing of first responders. We have been managing the testing of our firefighters and our police officers. Next week, we'll be ramping up that testing of our recruits. We have 75 recruits starting our Drill Tower Training Academy. That's a 22-week process. We'll be testing them weekly to ensure that they stay healthy. No matter the cause, no matter the reason, whether it's a fire or a health crisis, the men and women of the Los Angeles City Fire Department are ready to step up and do whatever is necessary to protect lives and property for the people within Los Angeles. And for that capability, I'm extremely proud. Now I'd like to introduce somebody who has more detail about our testing. Her name is Assistant Chief Katie Kepner.
Good evening. On April 7th of this year, myself and Chief Fortman received a phone call from the mayor's staff saying that he would like us to implement a rapid response mobile testing group to test some of our most vulnerable population, residents and staff in our skilled nursing facilities. This was something that had never been done, so we had to take a very innovative approach as there was no standard operating guidelines. We immediately called in Chief Linda Sesser, a battalion chief with our department, who developed a 6-member team within 1 day. It was 6 members from our Los Angeles Fire Department that were dedicated and hardworking and were ready to go implement this process within 1 day. The very next day, we went to our first skilled nursing facility to help facilitate testing. As of today, 6 weeks later, we have a team of 25 people and a huge collaborative effort. Of those 25 people, we have individuals from the mayor's staff, the LAFD, the LAPD, our disaster service workers, and of course the CORE organization, who has come in to help in all facets of the testing. With that group of 25 team members, every day we're able to make contact and help facilitate testing with multiple skilled nursing facilities. You heard that there are 135 facilities in Los Angeles City, and we have made contact today with every single facility and are in some phase of the process with each of them. So it has been an honor truly to be a part of this mobile testing group and what we've developed and what Chief Sesser has developed. She's really streamlined the system so that we can get skilled nursing facilities registered and tested within 72 hours and often within 24 hours. It's our responsibility to get the information of who needs to be tested, register them into the system, and then our teams go out to each facility, bring them tests, and train them on how to properly administer these tests to everybody that needs it in the facility. We go back and we pick up these tests within the next few days, transport them directly to the lab, and get the results as quickly as possible for these individuals. And testing them one time is not the only thing we need to do. As the mayor stated, it needs to be ongoing. So what we also do is set them up with Everly Wells and UPS. So after our immediate response testing, they can then get ongoing tested testing monthly for each of their staff and residents that need it, because we understand that if one test comes out negative, that doesn't mean that the next one will, and we need to catch it as soon as possible so that we can be proactive. So next up will be Dr. Marco speaking from the Jewish Home of the Aging.
Thank you, and welcome to the Los Angeles Jewish Home. We currently have 1,650 staff serving over 1,200 older with the average age of almost 90. In February, we recognized that our population would be particularly susceptible to the coronavirus disease and initiated our disaster planning drills. This was before the federal government initiated as national efforts to contain the coronavirus sputtered with insufficient supplies, insufficient testing, and mixed messages from government leaders. We launched our comprehensive to protect our patients and our staff. So grateful to Deputy Mayor Jeff Gorell, who contacted me on a Sunday and asked if I would partner with the city to offer testing to the seniors in our community. The program, as the mayor said, began on April 2nd. And using both the mobile testing program from LA Fire Department and the testing kits that we got directly from the mayor's office. We have tested 1,455 of our staff, 685 of our residents. Those numbers constitute all of the staff and residents who provide care and live in our nursing facilities. Our focus for these tests was to test those displaying the disease, not displaying the symptoms. Like many others, we knew that the virus is brought into facilities like this from the staff who are asymptomatic and living in the community, and then spread in the facility by the asymptomatic residents. So the test provided to us from Mayor allowed us to find 12 asymptomatic staff and 4 asymptomatic residents. Because of our testing efforts and our focus on infection prevention, we have had only 19 confirmed infections in 100 residents. Regretfully, we have had 3 deaths. May their memories be a blessing. The Joyce Eisenberg Kiefer Medical Center, right behind me, has 220 residents, and only one of them, 19. And she was picked up by asymptomatic testing. And she has done well, survived the illness, and is well on the road to recovery. Our experience, like the experience of so many other programs, proves that nursing homes don't have to. We encourage all facilities to follow Mayor Garcetti's orders and test their staff and their residents. If test kits are available, and they are becoming more available, not testing your residents and not staff is medically unethical and just plain wrong. Thank you.
Well said. Thank you, Christopher. And thank you so much to Dr. Marco. Thank you to our incredible fire department, and thank you to all of you. With that, questions, and I'll do my Spanish remarks as usual. Nice to see a reporter in the flesh. And thank you for being the pool reporter. Great, super.
First off, you talked about the firefighters.
Yeah.
And you talked about the still in the hospital. Are they're expected to be okay? Is that right?
Yes. Live. I think we've said publicly there was one firefighter who had bad burns and today had surgery on those hands. Others are still. Everybody who's intubated has been extubated. So optimistic, and there's 4 that are still hospitalized. The other 8 have gone home.
As far as the owner of this business, or the owners, we're getting a scene last night at the investigation.
Yeah.
is this? The chemicals?
I'm going to turn that over to the chief. There's an arson investigation. Obviously, we can only share what we can share, but Chief, if you want to address that.
Yeah, thank you for the question. The briefing task force of LAFD, LAPD, and ATF, they're out there on scene today. Cumulatively, we have about 50 or so investigators on scene. They are going to be looking at the effect of the incident. The fire itself, the video of the fire of our firefighters coming down the aerial was very compelling, and I'm amazed that our people survived that. Directly, I don't have any information as to any illegal. I'm going to wait until the investigation is complete, and then we're going to focus our efforts from the Los Angeles Fire Department to canvass the city to look for businesses of this type to make sure that they're in compliance with the fire code.
Is there any more questions for the chief before?
Well, this is sort of a crossover.
Okay.
Either one of you could take this.
No worries.
This is from NBC Los Angeles.
Sure.
To the mayor, the business that burned in downtown LA over the weekend, injuring a dozen LA City firefighters and leveling a building, appears to be one of unlicensed and unregulated marijuana-related enterprises. Packed with flammable material, yet none of the firefighters sent the report of smoke had any warning that hazardous materials were inside. What's to be done about that?
So I can't confirm as the investigation goes on. I'm glad that we have ATF and others that are involved. That said, we have made it a priority for some time to bring down as many of the illegal cannabis businesses throughout this city, both from a fair business perspective, a public, and of course, as we've seen too, the skirting of the law and just those individuals at danger. This business is very lucky. We could have had dead firefighters as a result of what may have gone on in here, and I don't want to confirm yet what that is. But there is no question that's why we have building and safety, DWP department, who all have the ability to, when we learn about things, to take down, and I can give you the stats, we've taken down literally hundreds of illegal businesses related to cannabis. This has to be something that is regulated, just as this is something that is now legal under state law, but that doesn't mean you can do anything. And as we've seen very tragically this weekend, the cost potentially of illegal activity, again, we need to confirm that, fighters nearly losing their lives. You can be rest assured a weight of the law will be brought against this business if we find any of those things out. And just know we have heroic people every single day that are taking down those businesses when we hear about them. Where we don't hear about them, it can be tough, and that may be the case here.
Okay, the next question comes from Corey with Spectrum News. Carter issued an order to provide housing for people living under LA's overpasses. What is your response to this?
Yeah.
What does the city plan?
So I think during the last briefing, people were saying the order existed, and I was saying there was no order because it literally came in a press briefing. Let me just say I love Judge Carter. I love his energy and his courage. I found a kindred spirit in him who wants to address this problem of homelessness with the kind of not only passion and commitment, but speed that has been lacking. It costs money, and many know that I called for a FEMA-like 2 years ago. Now, in this FEMA response we're having with COVID-19, we finally have resources we've never had before. And so we've been contacting him, discussing with him and the other parties the best way to use those resources. Better as they are, they're still not enough. And today with the county are in those discussions, submitting what we can do to not just help those folks come off the streets, but stay off the streets that are in hotels and motels, first priority. And secondly, what he put out, we move people away from the underpass, the freeways, where so many of us see the tragedy of homelessness every single day we get on and off of freeways. That's very important for their health, but I don't also want to spend tremendous resources moving people 20 feet when the health guidance is not during COVID-19. I want to give offers of where people can move, but perhaps a mile or two and get into housing, get into hotels. So we're going to try to balance those two things, but love the passion, love the direction. I'll be speaking with Judge Carter directly. We have a good relationship, and I hope that this week we can come to common agreement about the next steps, including the oversight.
Mr. Mayor, what discussions are you having with members of the faith community to make houses of worship a priority when it comes to relaxing safer home measures? And what timetable are you looking at for these locations?
He always wants a date. It depends on the state first and foremost. When the state phase or have another step in another phase forward, then we're able to do that in LA County. Then we have to wait for what LA County permits. For the city, this is the guidance I would give anybody from the state or the county. Obviously, we know super spreader events have happened at religious services, at choir practice. It is among the most dangerous places where this virus thrives and can spread. That said, allowing houses of worship to meet with people who are in dire times, those kind of personal meetings, just as when we open up finally other places, barber shops, that will probably be the model. And I think Governor Newsom spoke to that the next step when religious institutions are available to be open, it won't be for mass services. They meet with their priest or their rabbi or their imam to be able to get staff back into those facilities to provide many of the critical faith, spiritual, and counseling services. So I think that's what's next before we're going to be back in church or synagogue anytime soon with a lot of people around. With all of these steps, I want to reiterate what I said. We will as fast and as safe forward as possible. And that's tough for a lot of people who have said, close everything down. We did the right things to earn this plateau that we've had in cases, but we have to also realize the suffering there right now. But that shouldn't be fast, and look at the data. And where the numbers tick up, step back. Next question, thanks.
Next question comes from Steve Gregory from KFI News. President Trump spoke yesterday to a group of leaders, including Chef Thomas Keller, that the mayor of Los Angeles did not want to reopen until August and called the move a quote death race. He said people like the LA mayor don't understand there is death on both sides of this pandemic, the personal and professional.
Watch words that you didn't even say not only be not accurately. 2 weeks ago, when County Public Health Director Dr. Ferrer was asked about how long there would be a health order, she said at least 3 more months. That got interpreted as everybody would be locked for 3 months, which is not what I heard, not what she said, and she clarified that. I was the one that said it, and then it became a talking point that has gone, I guess, all the way up to the Commander-in-Chief. Look, I want to thank him for the help that he has given us and members of his administration that has been critical at many critical moments. I never make these things personal, and when somebody's him or her, no matter who they are, it's BS, and that's BS.
All right, I've got a few Spanish. Oh, you know what?
Yep.
Sorry, okay, this is from Claudia from KFI, so KNX 1070. Sorry, Claudia. Okay, so here's the question. She says, Chief Michael Moore's daughter took a trip to Arizona last week. What kind of message do you think it sends to the public that the chief's family would ignore rules you and the chief are urging the public to follow? And then the second question is, we continue to hear essential workers who are waiting as much as 10 days for their test. He says the average wait time for officers is 5 days. You said wait times did go up after the city opened up testing to all county residents. Did you expand testing too soon? How good is testing for asymptomatic people? How good is it if people results?
Sure. Remember there. Asymptomatic, as we heard from Dr. Marco, testing is critically important. If we didn't do that here, we wouldn't have found, 16 people, I think? 16 people here. Killed other folks that asymptomatic testing. Second, we're seeing those wait times come way down. I have a couple people who said they've gone the last couple days and it was a 3-day turnaround. But we wanted to bring those back down to 30 hours where we had them. So we're going to continue. We wish that was solely in our power, but that's not. Third is it's going to be important for us to mass testing where we need it here and in senior nursing facilities. That's done separately. And those can take, unfortunately, longer period of time. There's no good options out there right now for quick turnaround. But we got it down to the lowest level, and I think we'll be able to return in the coming days. There's just been a bit of a backlog. In terms of the first question, I'm not about calling people out, but yes, of course, it depends on all of us to make sure that we are abiding by the orders. That's the way we're going to. We're never going to be 100% perfect, but no matter who we are and no matter where we go, make sure that we aren't bringing and or spreading this disease. These next months will be critical. If we can prove that we can live with COVID-19 safely, we can keep taking steps forward. But that requires tough for businesses out there. I hope a second round assistance, grants and or loans from some of the coronavirus relief funds that we've had. And so look for that hopefully in the next couple of weeks together with Council President Nury Martinez, the City Council. Español, yo quiero decir unas palabras de esta pregunta de distrito de ropas en downtown. Todos los negocios en Los Ángeles hay una prohibición de desalojo de evicciones. No, este es por los inquilinos residenciales, comerciales también. Y si tú tienes un dueño que está dando a usted papeles o otras cosas para un desalojo, este es ilegal. Tiene 3 meses después del fin de esta crisis. Segundo, yo tengo programas para asistir las compañías, los negocios en Los Ángeles y yo espero a tener una segunda próximas 2 semanas para prestar dinero directamente efectiva a los negocios de Los Ángeles. Yo soy un nieto de 2 negociantes de negocios pequeños, un barbero y mi abuelo al lado de mi mamá fue un tailor, una persona que tiene un negocio como estos en downtown Los Ángeles. Es una prioridad para mí para salvar sus compañías, sus negocios y también los trabajos en estas compañías también. Gracias.
Supervisor Catherine Barger on a possible reopening date of July 4th. If so, what would we expect the city of Los Angeles to look like then?
Yeah, before she's misquoted and then that goes to the next senator or president misquotes her, to listen closely to what people say. Catherine Barger was asked today when plans for the county strategies for reopening would be done. That was June 30th. Somebody asked about July 1st. She said, I would hope we could be open by then, but to open there, that's a deadline. Look, we're opening up things safely. But at the same time, I can't tell you 2 weeks from now what the death rate will be. I can tell you 2 weeks from now, and I can make a good decision based on that together with the county. But these are all national goals, and I think we should avoid saying specific dates. We should look at is and get ready to open. Do all the preparation work. Be prepared to. But of course we hope for it to be tomorrow. We hope for it to be July 4th. We hope for it to be as soon as possible, but we have to grab the safest way to open up, not just the most hopeful way. very carefully. I love Supervisor Barger. She's been an amazing co-partner in this. And I know she was just saying, hey, we'd love to be open by then, but that doesn't mean the county is planning on that today. It could come later. And by the way, the idea of opening the economy will be done in one fell swoop. That's never going to be it. It's going to be a series of steps. The county has been clear about that. The state has been clear about that. Even our federal government has been clear about that. And there are not places that are wide open and others that are wide closed, narrowly closed. Everybody has some things open and some things quick we can go according to the data and the deaths in our community. Let me say that as well in Spanish. Este día fue palabras de supervisador Barger y es muy importante tener en estas palabras. Dijo que fue su esperanza abrir más de la economía por el 4 de julio, Día de la Independencia de los Estados Unidos. Pero este solamente es una esperanza, no es una decisión. Antes de julio, nosotros abriremos más. Cada paso está basado en los datos, la información, los muertos, y podemos dar una fecha específica. Cada día nosotros podemos dar a ustedes la información crítica y las decisiones de este día, la próxima semana, etc. Este es muy importante porque las palabras de los oficiales, especialmente en esta dirección, ha portado en una manera que no es la verdad siempre. Y con esto, este es una meta, una esperanza, pero no es una fecha específica. Any other questions?
That's it.
Okay. All right. I'm going to go to. Thank you to everybody who's tuning in on English. I wanted to also say for those who are watching on Channel 35, Councilmember Krikorian's Town Hall meeting for seniors is going to be at 9 a.m. It will be televised 9 a.m. tomorrow because I know some folks were for that. And thank you, Councilmember Krikorian, for your chair as well. Let me speak in Spanish now, and thank you to everybody in English for tuning in. We'll see you very soon. Muy buenas tardes, Los Ángeles, y gracias por venir esta noche. Es un placer estar aquí hoy en el Valle de San lugar de mi nacimiento, y en la personas de tercera edad en Reseda, en el corazón del Valle. Y estoy aquí con el jefe del Departamento de los Bomberos, Ralph Terrazas, la jefa asistente, Katie Kepner, quien está en el programa de pruebas, director médico de esta residencia. Hay una serie de pautas para mantener nuestra salud y protegernos. Primero, quédense en su casa lo más posible. Segundo, siga practicando la sana distancia. Tercero, lave sus manos. Y de último, cubra su cara. Si toman estas acciones, lo más pronto podremos regresar a espacios públicos en el futuro, más sectores de la economía, más prosperidad. Estas acciones. Y los estudios indican que podremos mejor contener el brote con cubrir nuestras caras. A todos quienes han estado llevando coberturas faciales, les agradecemos mucho. Por eso hoy estoy anunciando algo importante. Efectivo inmediatamente, servicios de peluquería de mascotas, paseos de perros y negocios para mascotas ahora son permitidos, incluyendo móviles. Nuestras mascotas reciben cortes de pelos antes de nosotros, pero está justo. Los clientes podrán dejar y recoger a sus mascotas afuera del negocio, al igual que otros negocios, solo pueden entrar a la tienda. Además, la operación de todos los lavados de auto. Anteriormente solo se permitirían servicios de express o optimizados. Las pautas para la operación segura de estos negocios se puede ver en la página coronavirus.org business. Los datos de hoy. Hoy hubieron 1,183 nuevos casos en el condado de Los Ángeles, llegando a un total